Hey guys, welcome back to the FRG channel. So today we're going to go over yet another one of the skills that can present on your skills test, CPR and AED.
So you've entered a code scenario. The first thing that you're going to do is make sure that your patient is unresponsive. So you're going to shake them and tap them bilaterally on both sides of the chest and shout, "Hey, hey, are you okay?" After you've determined unresponsiveness, you're going to check for signs of life. So you're going to check a carotid pulse on the opposite side to check for a pulse, as well as examine the chest for chest rise for breathing. Once you've determined that there's no pulse and no breathing and therefore no signs of life, you're going to start CPR, or cardiopulmonary resuscitation. To do this, the first thing you're going to do is start chest compressions. By forming a straight line from your wrist to your shoulder, you're going to compress the chest at a depth of 1/3 the depth of the chest, or approximately 2 inches in adults. You're going to compress at a ratio of 30:2, compressing at a rate of 100 to 120 beats per minute. Shri is going to come in with the BVM, or bag valve mask. This is used to deliver oxygen to the patients and attached using a CE clamp. You are going to ventilate until chest rise, opening the airway with a head tilt chin lift. We are going to rotate every 5 cycles, or 2 minutes. We are compressing in a 30:2 ratio of 30 compressions to 2 breaths, or in a multi-responder pediatric scenario, 15 compressions to 2 breaths. Then Taylor is going to come in with the AED, or automated external defibrillator. The automated external defibrillator is used to correct abnormal cardiac rhythm and restore normal cardiac rhythm. The first thing to do with an AED is to turn it on. Then you will apply the pads to the upper right and lower left quadrants of the patient. Never stop CPR during the application of pads. Once pads are turned and applied and the AED is turned on, the AED is going to say analyzing rhythm. At this time, all individuals will remove their hands from the patient to prevent interference. Once this is complete and the AED says rhythm analyzed, you will check a pulse to make sure that the patient's pulse is not returned over the course of CPR. If the AED says shock advised, continue CPR until it is done charging. Once the AED is charged, make sure to clear all participants and people in the resuscitation attempt from the party receiving the shock. Once you defibrillate, immediately check a pulse and return to CPR. If the patient has returned to pulse but is still not breathing, continue with rescue breathing, which occurs using the CE clamp and chest rise ventilation standards. Rest should be given every 5 to 6 seconds in adult scenarios and every 2 to 3 seconds in pediatric scenarios. Congrats, you successfully ran your first code.
Just a reminder about coding in your scenarios. So your patient can code in a medical and a trauma. There's a few reasons for medical, and there's about 5 reasons in trauma. So once for medical, it's once you've moved on from sample. In your trauma scenarios, it's once you gotten your patient onto the backboard. Your proctor will say your patient has coded, they have no pulse and they're not breathing, and you'll be asked a couple of questions and you'll need to run through that code. Remember, this is a sign to you that there is something wrong, there is something that you missed, either you did not identify it or you did not treat it throughout your scenario, and it is something very vital to the patient's well-being. So this code is kind of a little hint like, hey, something's messed up, you need to go back and check it. So go over the reasons why your patient can code, so if it does happen, you know what might be going on and you can go back and reassess those things. Good luck and thank you for watching.